Okay, I'm going to be dry needling MJ's neck today. This has been an awesome supplement to our therapy practice, and while manual therapy and therapeutic exercise are certainly important aspects of therapy, this dry needling has been a really fantastic supplement to our treatment and has helped a lot of patients, specifically talking about the neck with chronic headaches, muscle spasms, discomfort with prolonged sitting at their job all day. It's been really, really effective. So dry needling is just an internal way to affect trigger points, which most people would describe as the knots in their back or in their neck. I can certainly do some soft tissue work, some deep tissue work to MJ's neck. That would be very effective, but the dry needling takes a fraction of the time, and usually I only have to do several treatments of this to have the long-term effects that I do with my hands. So it saves MJ having the deep tissue pressure, tolerating that, and it saves my hands. So it's been awesome. It is not like getting a shot or like getting a tattoo. It's really a very thin filament that acupuncturists use. However, it's very different from acupuncture. We are specifically trying to locally target one trigger point and release that trigger point to stop causing referred pain. Speaking in the neck, specifically, we're talking about headaches and referred pain to the temple area, to the forehead. So I've already marked MJ's tender spot here, which is why you see some of the redness in that area. But I'm just on the left side of her spinous process, and I'm going to come off of the side of that with the needle. I've cleaned this area already. I'm going to hold that still, and then I'm going to give a little tap of the needle, and it's in. MJ, how are you?
I'm fine.
Good. So I'm going to go down and in towards the spinous process. This is a fairly safe location to needle because we have a very good bony backdrop there. There's no risk of me affecting the disc, affecting any nerves or vascular structures, so it's safe and it's very effective. MJ, how are you feeling there?
It's fine.
Good. So I'm palpating with my hand first for any muscle response. I'm looking to see if there's a contraction of the muscle around the needle. And I'm also palpating at the needle to see if I feel some resistance, which I do in that area. MJ, do you feel any pressure there?
Yes, a little bit.
Very good. So some patients will say that they feel localized pressure in this area. A lot of times people will say that they can feel referred pain up into their head, around their eyes, wherever the location of their headaches typically manifest. So I can leave that needle. Typically, those symptoms will start to pass within 5 to 10 seconds, sometimes a little longer depending on how chronic the pain has been. MJ doesn't have any presenting issues. She's being sweet and volunteering today, so I don't expect to find any significant problems, but I can do one of two things when I hit an area of restriction. I can, let that sit for a minute, or I can try to wind that tissue up by giving a little twist, and I can also do an in and out pistoning movement. I'm doing that to see if I can feel a release of the muscle and see if it goes from feeling tough to move through and boggy to being smooth like butter. And at this point I feel that, and so I'm going to pull out. MJ, how are you?
I'm fine.
Perfect, and that's how it's done.